Hi everyone, welcome to Wednesday Wisdom. So for today's video, we are going to be looking at the main conditions affecting the wrist, hand and also up into the elbow. So this is actually incredibly common, and a lot of people think that when they come to see an osteopath it's all about lower back or back pain, but actually I see a lot of wrist and elbow issues. So it's being able to identify that, being able to talk you through kind of the main conditions we see, because if you're suffering with any of these, how you manage them, how they present and what you can do to look after yourself. So number one here, I've put down carpal tunnel, tunnel ligamen. So for me, these are pain around the wrist. So a lot of us know about carpal tunnel, or we self-diagnose with carpal tunnel, but we might not actually know what it entails. So they are peripheral neuropathies. So whenever we have any entrapment of the nerve coming down, so once it's left the neck, so the brachial plexus and comes down into the hand, it basically has points as it passes down into the elbow and into the wrist, where the nerve is at a higher risk of getting compressed. So if we take the carpal tunnel, for example, for the first type of neuropathy, your median nerve comes down, it blends, it merges through, goes through your pronator muscle down into here, down into the wrist. So it can get compressed here, here or here. What typically happens with carpal tunnel, with people with repetitive work or pressure around here, your median nerve gets compressed within the tunnel here, which is made up of a flexor retinaculum, so covering over the top and the bones. What happens is if we have pressure around the wrist, this might be someone with repetitive activity like an office worker, pregnancy, any conditions that causes swelling around here or anything that causes pressure, so if you're gripping onto stuff day to day, it compresses the nerve here. What it typically presents with initially is pain and sensitivity. What it then manifests to, and this is what we will be looking at as an osteopath and screening for, is numbness and tingling over these three fingers, or two fingers and thumbs, sorry. So this is the distribution of the median nerve typically. What can happen is you get tingling and dysesthesia over these fingers, which is why the osteopath will ask, where are you feeling the pins and needles, as well as weakness into the flexors, into the thumb movement. So that is how we present with carpal tunnel. What we can also get is something called cyclist palsy or tunnel ligamen compression, and that is your ulnar nerve. So it's a different nerve getting compressed. So ulnar nerve, exactly the same, leaves and blends and comes down into the arm, this time on the inner part of the arm coming down, and can get compressed here in something called the tunnel ligamen. So it's a tiny, tiny little structural complex here. How that typically presents is dysesthesia and tenderness over these two fingers, as well as weakness into flexion and grip of those fingers, as well as abduction. So you might get sensitization and soreness through here. Exact same triggers, anything that causes compression and soreness to form around here. So what we would look at as an osteopath to treat these conditions is looking at relaxing. So we're considering something called a double crush lesion. So is it getting sensitized down its course into the arm and into the wrist? But also looking at your day-to-day posture, anything that's adding pressure, any tightness, any issues in your thenar and hypothenar eminence, which are the cushion structures here. So we want to release through. So that's the first thing. Second common conditions that tend to blend together is something called de Quervains, tenosynovitis and intersection syndrome. So they sound very fancy, but actually what it breaks down to is, again, repetitive movements, pressure through the hand and into the elbow, repetitive tightness typically. So if we're taking de Quervains, tenosynovitis, this is over the thumb. So people typically present with radial pain down here. So here, as it comes down here. What happens with de Quervains is that we get thickening of the tendon sheath. So you have two tendons that come down here, or the two main ones involved. Obviously lots of tendons down into the wrist and the hand. The two ones that are involved is abductor pollicis longus, extensor pollicis brevis. So those are the tendons recruited for thumb extension and abduction. What happens if we're doing anything where it involves screwing or repetitive work into the thumb or pressure, you can start to get tenderness and soreness through here. What we would look at as an osteopath is also removing any of the triggers that would cause that to inflame and become sore. One of the tests we would do is Finkelstein, so testing and pressing away and seeing if that triggers anything, and soreness through there, and also looking for compensation, so tightness around into the thumb and into the wrist. What we also want to consider here is intersection syndrome. So this is where the tendons cross around the thumb, so there's a little section here. This again is very common with people who do a lot of like typing, desk-based work. You get thickening of the tendons here, extensor carpal radius longus and brevis. And obviously the two tendons I spoke about, as they cross over, they can intersect and cause soreness. So again, from an osteopathic point of view, we'd want to look at function around the thumb, function around the wrist, any causes that could trigger more tightness to form around this area to relieve that pressure. The other conditions I want to talk about around the wrist today, so I'm trying to pick my kind of top 3 ones that we would see, is TFCC and sprain. So TFCC is your triangular fibrocartilaginous complex. What this is a disc and ligaments formed in this side of the wrist here. Its main role in the body is to stabilize your radial ulnar joint, so the 2 bones here, and to help with pronation and supination into the wrist. So stabilization, you need it to stabilize. If we're doing repetitive stuff of twisting or pulling or pressure as we fall down into the wrist, that can cause damage to the ligaments and the articular disc, which is what forms the TFCC. What we typically present with is grinding and soreness and pain around the wrist line, so here, and weakness picking up. What we would test for during a consultation is look for stuff like piano sign, loading and grind test. So basically all these tests look at is instability and soreness through here to see if the ulnar bone has lifted up as you're having the hand flat. What you typically get is the fork sign where it kind of lifts up through, and it just shows instability. What we would then do for that is sending off for imaging. You'd want to see the extent of damage and see what you've done into the wrist to see if any bracing or help is needed. And then if that's all been clear and everything's been okay, possible manual therapy to help with scar tissue and movement around the wrist. Finally, thinking of sprains, very similar to kind of in the ankle, knee, shoulder, you know, where we sprain all joints, you're looking at different grading, and this is where we get damage of the ligaments around the wrist and the hand. And so we get different points where we get soreness, swelling, pain, possible bruising and instability. And so depending on where the sprain has occurred into the wrist, this can be from a repetitive or a foosh, so falling on an outstretched hand, or trauma around the area, you'd want to grade the sprain, so always go and get this assessed first. Similar with an ankle sprain, you want to make sure there's no complications. So the carpal bones in the wrist are very delicate, very sensitive, as well as little ligaments around each of the joints. So you want to make sure that you've not damaged or damaged or caused issues to any of the structures around this area, even before we have a look at rehabbing and sorting out a sprain. Once that's all been cleared by a specialist or through A&E, whatever you've done to get it assessed, then we can start to look at stabilization and movement, but that needs to be assessed first. So my take home thing is, if you think you're suffering with any of these, feel free to kind of pop in, we can assess and have a chat. We'll be able to tell quite quickly if it needs a referral, depending on onset, symptoms and how it's presenting. If that's all been cleared by the recent and by the expert musculoskeletal expert, then we can have a look at treatment, help and management as well. So hopefully this has all made sense and been quite interesting. I love talking about the wrist. I think there's lots of different conditions that arise around here that are often overlooked and diagnosed as a sprain, and actually it's a lot more complicated than we realise. So as always, hope that was helpful with regards to Wednesday Wisdom today. I got asked to do this by someone who was suffering with wrist pain, so that's what I want to do, is open the floor to you guys to suggest any conditions or issues or problems you would like me to look at, and then I can cover that next time. But have a fab Wednesday.